The Trump administration today unveiled a sweeping plan to tackle childhood chronic diseases. You may have heard of it. It's called the Maha movement, the Make America Healthy Again Commission says that their strategy this time will tackle more than 120 initiatives. Now, they're trying to reverse what they say are failed policies that fueled America's childhood health crisis. Health and Human Services Secretary Robert F. Kennedy Jr. heads the commission. He says the main plan includes reforming dietary guidelines, improving food labeling, and removing harmful chemicals from the food supply. But the commission says one main priority is also vaccine-related injuries. Another is helping children with better diets and avoiding ultra-processed foods, and that's why we have Karen Ahrens, who is a licensed nutritionist and U.S. policy manager for the Alliance to End Hunger. Ms. Ahrens, thanks for being with us. Let's start, first of all, what do you think about this plan that wants to cut out those ultra-processed foods that we hear so much about?
Well, I'm so glad that there's attention being drawn to the health of children, because as a mom, a dad, grandparents, aunties, and uncles, we all can get behind that. We want healthier children. So we're very glad as the Alliance to End Hunger for that. Before food gets to our tables, from between the field and our plates, some sort of preparation of those foods has to take place. Sometimes it's called food processing. Sometimes it's just washing and cutting vegetables. So I think their plan to define what process means is an important step. One thing that's missing that we didn't see in the report was the acknowledgement that people in households, schools, child care centers, older adult centers have to be sure to have the resources they need to be able to afford and purchase healthier foods.
Ms. Ahrens, who's the bad guy in this story? I have a daughter now that has a farm in our backyard because she doesn't want to eat anything that she gets out of the grocery store. The generation before her generation, did we just eat bad food? And if we just ate bad food, who's to blame?
Over the course of the years, there have been lots of changes to the way we live in the United States. And right now, we have a lot of people who are working more than one job. They have less time to cook and prepare foods. So places where we can get foods like school meals, or grocery stores, or the WIC program or the SNAP program, all play an important role in the foods that we eat. When we have less time to spend in the kitchen, we allow more of the process of that food preparation to happen outside our own kitchens. So I think that is part of what's happening. And I think we can all benefit from more commitment to choosing healthier foods and helping each other out, being able to have the resources to have those healthier foods.
You know, one of the things that RFK Jr. did talk about that would be provided under food assistance programs, he said that junk food purchases would be restricted. You talked about them just a moment ago, and that instead provide Maha boxes of whole, healthy foods. It seems like this should be a step in the right direction that everybody agrees with.
Well, what we know is when people have enough resources to go out and choose the foods that fit into their lifestyles, their way of eating, their cultures, their backgrounds, and they can make those choices themselves, things are much more likely to lead in the way of health. We have had things like the SNAP nutrition incentive programs that help people purchase more fruits and vegetables. We have had improvements to the WIC program that help people access more fruits and vegetables. And so those are the kinds of resources that we need, incentives that help people make the best choices for their families. And if food boxes are provided, can they be sourced with local foods produced by local farmers? Can people have a say in what's in the box to make sure that the food doesn't go to waste because they've been shipped something that their families can't eat or doesn't fit into their culture or that they don't like?
Yeah, I've also found it so curious over the course of the years that what we eat in this country, they won't serve in other countries. The Maha movement coming out, for instance, against the use of petroleum-based food dyes in our food, but without an outright ban. Is that possible? Is it possible to make our Fruit Loops a little less colorful and also as tasty?
I think the focus can be on choosing more healthful whole foods, and maybe not spend a lot of our time and energy on what color our food is, except when it comes to fruits and vegetables, because choosing a rainbow variety, in that case, a rainbow variety of colors helps support our health.
Ms. Ahrens, the one thing that did not happen today is they didn't release a date for new dietary guidelines. As a licensed nutritionist, would you like to see those guidelines released, and what would you like them to include?
I know that there has been a group of advisors who have been working for years on preparing the next edition of the dietary guidelines, and that these are all people with backgrounds in research and nutrition, and I've been trusting them. So I look forward to the dietary guidelines being released because they set a standard for what's in the other federal nutrition programs. So I do look forward to those. I look forward to them being based on science and the recommendations of nutrition researchers and nutrition professionals.
Final question before I let you go. You work for an organization that works to end hunger and malnutrition. Is the Maha movement going far enough?
Well, as I stated, we don't see anything in the report that talks about making sure that people have access to foods and the resources they need to purchase them. So we know that together we can make America healthier, but people have to have the resources to bring food home to their tables and to their plates. So we'd like the administration and Congress to remember that, because it's up to Congress, after all, to provide the resources to implement these recommendations.
Going back to my daughter's garden, I will simply point out that I saw one of the ugliest carrots I think I've ever seen, but it tasted pretty good. Karen Ahrens with the Alliance to End Hunger. Ms. Ahrens, thanks for being with us.